Early childhood, elementary, and secondary education will come to order. Welcome, everyone. I note that a quorum is present. The subcommittee is meeting today to hear testimony on back-to-school best practices for reopening schools. And this is an entirely remote hearing. All microphones will be kept muted as a general rule to avoid unnecessary background noise. Members and witnesses will be responsible for unmuting themselves when they are recognized to speak or when they wish to seek recognition. I also ask that members please identify themselves before they speak. Members should keep their cameras on while in the proceeding. Members shall be considered present in the proceeding when they are visible on camera, and they shall be considered not present when they are not visible on camera. The only exception to this is if they're experiencing technical difficulty and inform the committee staff of such difficulty. If any member experiences technical difficulty during the hearing, you should stay connected on that platform. Make sure you're muted and use your phone to immediately call the committee's IT director, whose number was provided in advance. Should the chair experience technical difficulty or need to step away, um, Mr. Levin or another minority member or another majority member, I apologize, a majority member is hereby authorized to assume the gavel in the chair's absence. This is an entirely remote hearing. As such, the committee's hearing room is officially closed. Members who choose to sit with their individual devices in the hearing room must wear headphones to avoid feedback, echoes, and distortion resulting from more than one person on the software platform sitting in the same room. Members are also expected to adhere to social distancing and safe healthcare guidelines, including the use of masks, hand sanitizers, and wiping down their areas both before and after their presence in the hearing room. In order to ensure that the committee's 5-minute rule is adhered to, staff will be keeping track of time using the committee's digital timer, which appears in its own thumbnail. Members and witnesses are urged to wrap up promptly when their time has expired. Pursuant to Committee Rule 8C, opening statements are limited to the chair and the ranking member. This allows us to hear from our witnesses sooner and provides all members with adequate time to ask questions. I now recognize myself for the purpose of making an opening statement. Today, we're discussing the obstacles schools have faced to safely reopen and how school districts are using the funding from the American Rescue Plan to protect students and staff and get students back on track. Each of us here agrees that safely reopening schools for in-person hearing is critical to our fight against COVID-19. Across the country, students are returning for the third school year under the cloud of a pandemic that has disconnected millions of our students from their education, expanded achievement gaps for students of color, students with disabilities, and English language learners, and eroded students' mental health. The emergence of the Delta variant has elevated the threat facing our students. According to the American Academy of Pediatrics, more than 240,000 children tested positive for COVID-19 during just 1 week earlier this month. Alone, 1 week. Fortunately, young people who contract the virus appear to have lower risk of serious illness. However, lower risk is not zero risk. COVID-19 has claimed the lives of nearly 500 Americans under the age of 17. That's more than 2.5 times the number of students who have succumbed to influenza, the flu, over that same period. And while young people are more likely to recover, the risk of lingering symptoms and the risk of transmission to adults must be taken seriously. The Delta variant has intensified the challenges facing school districts and the importance of implementing a science-based layered mitigation strategy to keep students and staff safe. With the right precautions and resources, schools can mitigate the spread of COVID-19 and safely reopen classrooms. This is why House Democrats passed the American Rescue Plan, providing $122 billion to ensure school districts have the resources to follow public health guidance, reopen and remain open, and support students' academic and social emotional needs. Today, our witnesses will help us examine how schools are using these resources to navigate the difficult challenge of reaching these goals. In North Carolina, for example, schools that implemented proper mask use largely use proper mask use largely prevented transmission of the virus, according to one study. In San Francisco schools, where 90% of adolescents are fully vaccinated, there has there have been no COVID-19 outbreaks since classrooms reopened. And a recent nationwide survey of school superintendents found that three-quarters of school districts are using federal funding for summer learning opportunities so that students can catch up on lost time in the classroom. In my district, the Northern Mariana Islands, schools are also using this funding for summer learning, as well as hiring more teachers to work with students needing additional support and installing new ventilators in each classroom to help prevent virus particles from accumulating. Unfortunately, some states and school boards have chosen to play politics with these resources instead of following the science. In Florida, Republican education leaders have even blocked funding for districts that require mask use. The state has one of the worst COVID infection rates in the country, and its schools desperately need resources. Undermining school funding only makes it harder for students to safely return to classrooms. Research shows that schools that started the academic year without mask requirements were over 3 times more likely to have a COVID-19 outbreak between August and September. However, we also know that reopening classrooms and making up for lost learning time is not enough to ensure equal access to quality education. Earlier this month, the committee took the step by passing its portion of the Build Back Better Act. This included significant investments in school infrastructure and teacher preparation that our schools and students need. Today's hearing is an opportunity to learn from experts about the obstacles schools face to reopening safely, how schools can keep students in the classroom safely, and how states and districts can leverage federal grants, federal funds to build a more equitable education system for the future. I now turn to the ranking member, Mr. Owens, for the purpose of making an opening statement. I now recognize the distinguished ranking member, Mr.
Thank
Owens.
you. Thank you, Mr. Chairman. The American Rescue Plan did not deliver on its promise to help schools safely reopen in this fall. If it had, we would not be sitting here in this hearing today. Untargeted funds was never the answer to safe school reopening, and the Democrats sabotaged those efforts even further by voting not to require in-person learning as a condition to COVID-19 relief funding. Our top priority must be protecting children's access to classrooms for full-time in-person learning. To accomplish that goal, we must lean on the scientific facts and not political fiction. According to the CDC, schools are not a significant source of COVID-19 spread or infections. The current surge we are experiencing in COVID-19 related hospitalizations began in June, long before schools reopened, and the data from the Los Angeles Unified School District show that infection rates in that school dropped following the mass school reopening. We also know that children are at exceptionally low risk of infections from COVID-19. For adults, including teachers, school administration staff, and children over 12, there are several safe, effective, and widely available vaccines that are proven to ward off serious infections and hospitalization. For those in need of extra protection, masking is also available. While the science behind the benefits of masking for our children is questionable, parents know best how to safeguard their children's mental and physical health. As such, the federal government has no business dictating medical decisions on behalf of individuals and families. Clearly, the classroom setting does not heighten the children's and teachers' risk of severe COVID-19 cases. But for all children, especially those with disabilities and experiencing domestic abuse or poverty, are at exceptional risk of learning loss and mental health decline from remote learning. To make matters worse, We do not know the long-term implications of mass school closures, but preliminary data study suggests that it is negatively impacting the entire trajectory of students' lives. During the 2020 through 2021 school year, students fell an average of 5 months in 5 months behind in math and 4 months behind in reading. Low income and minority children were especially impacted by these closures, falling 1 to 2 months further behind than their white peers. To put this in perspective, as a result of pandemic-related learning loss, students may earn $49,000 to $61,000 less over their lifetime. That would impact the U.S. economy by 128 billion to 188 billion annually once this generation enters the workforce. Every child's life and learning are important. We should do everything we can to ensure that they receive a high-quality education. But this is not just individual futures on the line. Our entire society stands to lose if we cannot get our educational system in order. Democrats are choosing the devil we don't know, the long-term impact of learning loss, over the devil we do know, COVID-19. We have a long-term mitigation and prevention strategies in place to prevent serious infections. We do not have a long-term strategy in place to re-educate millions of students who fell behind or off the school radars altogether. More funding is not the answer. More government mandates is not the answer. I urge our committee to lead by example and fully reopen as a signal to schools across our country that it's safe for them to do so too. Thank you to all the witnesses for participating in this important discussion today, and I yield back a balance of my time.
Yeah, thank you very much. Thank you, Mr. Owen. And now, without objection, all other members who wish to insert written statements into the record may do so by submitting them to the committee clerk electronically in Microsoft Word format by 5 p.m. on Wednesday, September 13. I will now introduce our witnesses and start with Dr. Jesus Jara. Mr. Jara, I would like for you to know that my late father also was named Jesus. And Mr. Jara has served as superintendent of the Clark County, Nevada School District, the 5th largest school district in the nation since 2018. Previously, he served as the deputy superintendent for Orange County Public Schools and the superintendent and chief operations officer in Monroe County Public Schools in Florida. He received his doctorate in education policy, leadership, and administrations from the University of Massachusetts in Amherst. I am pleased to recognize my distinguished colleague, Chairman Robbie Scott, to briefly introduce our next witness.
Mr. Chairman. Thank you, Mr. Chairman, and I'm very proud to introduce somebody I've known for about 25 years. Denise Ford has worked in leadership roles in several nonprofit organizations and spent 20 years in progressively senior congressional staff roles, starting on my staff, and most recently as staff director for the House Committee on Education and what was then the workforce. On the Democratic side, she also served as the Obama administration at the Department of Education, where she held the positions of Principal Deputy Assistant Secretary and Acting Assistant Secretary in the Office of Planning, Evaluation, and Policy Development. She has a BS in Computer Science from Duke and an MA in Women's Studies from George Washington University. And now she serves as the interim CEO of Education Trust, a well-known, well-respected national nonprofit research and advocacy organization that works to close opportunity gaps that disproportionately affect students of color and students from low-income backgrounds. So it is certainly a pleasure and a delight to welcome Denise Ford back to the committee.
Thank you, Chairman Scott. Our next witness is Mr. Mr. David Ziaik. Did I come close, Mr. David? Who is a freelance journalist who has written for The Atlantic, the New York Times, and the Wall Street Journal, among other national publications. See, I'm going to say David here. I apologize. David has been invited to lecture about the intersection of media, technology, and psychology at numerous universities and academic conferences around the country and abroad. He has also written extensively on issues related to COVID-19, kids, and schools. Our other witness is Dr. Ashish Jha. Uh, wow, I thought it's Jesus, but Mr. Dr. Jha is Dean of the Brown School of Public Health, is recognized globally as an expert on pandemic preparedness and responses, as well as on health policy, research, and practice. Previously, he served as a faculty member of the Harvard T.H. Chan School of Public Health and Harvard Medical School, was the director of the Harvard Global Health Institute, and served as the Dean for Global Strategy at the Harvard T.H. Chan School of Public Health. Dr. Jha received his MD from Harvard Medical School and holds a Master's in Public Health from the Harvard T.H. Chan School of Public Health. Um, we appreciate the witnesses, all of you, for participating today and look forward to your testimony. Let me remind the witnesses that we have read your written statements and they will appear in full in the hearing record. Pursuant to Committee Rule 8D and committee practice, each of you is asked to limit your oral representation to a 5-minute summary of your written statement. Before you begin your testimony, please remember to unmute your microphone. During your testimony, staff will be keeping track of time and a light will blink when time is up. Please be attentive to the time, wrap up when your time is over, and remute your microphone. If any of you are experience technical difficulty during your testimony or later in the hearing, you should stay connected on the platform. Make sure you're muted and use your phone to immediately call the committee's IT director, whose number was provided to you in advance. We will let all the witnesses make their presentations before we move to member questions. When answering a question, please remember to unmute your microphone. The witnesses are aware of the responsibility to provide accurate information to the subcommittee, and therefore we will proceed with their testimony. And I will first recognize Dr. Jara. Dr. Jara, you have 5 minutes, sir. Please.
Thank you, Chairman Sablan, Ranking Member Owens, and members of the subcommittee. Thank you for the invitation to participate in this hearing. For the record, my name is Dr. Jesus Jara. I serve as the superintendent of the Clark County School District in Las Vegas, Nevada, the 5th largest district in the country, serving 304,000 diverse students as a minority majority school district with over 70% of our children receiving free and reduced lunch meals. We reopened our schools in March of 2021. This feat was only possible because of our 42,000 employees, our business and community partners, and the families of the Clark County community. Federal support from the American Rescue Plan made it possible for our school district to stay connected to our students so they could continue learning from home during the pandemic. As we adapted to these unprecedented circumstances, we went from crisis to response, then to stabilization to improvement. But let me illustrate what the Clark County School District did to respond. When the pandemic hit and the decision to shut down was made, our priority was to protect our students and staff. We sent everyone home and then set about creating distance learning options so students could connect and learn from their teachers. We quickly discovered that many of our students did not have internet access or mobile phones. One young woman in high school who had no internet access or a mobile phone asked a friend to contact her teachers to get her missed assignments. Once alerted to her circumstances, her teacher relayed the information to the administration and provided the necessary connections for continued learning. This young woman caught up in her assignments and proud to say that she will start college next fall. Similar stories played out throughout the school district and our country and our public schools. In a matter of weeks, we were able to deploy over 247,000 devices and provide internet access to the students who previously did not have it. In 2020, student mental health escalated, and we moved to intervene immediately. The district created Lifeline, a program to enable educators and leadership to interface with and determine students' level. We also instituted protocols to ensure students isolated at home could meet with school-based mental health professionals in virtual and in-person format. We know kids need to be with their peers in the classrooms, learning from their teachers. As we design our back-to-school plan, we consulted stakeholders throughout the school district and our community, including our 5 bargaining units representing 42,000 employees of the Clark County School District. Together, we instituted a mask mandate and social distancing protocol, purchased and provided PPE, enhanced cleaning protocols, and improved ventilation systems. Without their buying and voices in the process, we would not have been able to reopen our schools in March of 2021. Like so many other urban districts across America, my colleagues and I are experiencing staff shortages. We need more substitute teachers, bus drivers, cafeteria workers, and custodians. All of these vacancies are putting instruction, extracurricular activities, and maintenance of our district assets at risk. The American Rescue Plan COVID relief funds enabled the Clark County Public Schools to prioritize the needs, address obstacles, reopen safely to support students' social and emotional learning and academic needs. We enlisted over 80 non-governmental organizations to help us design a program called Focus on the Future of Our Kids, Community Input Process. We have received over 13,000 responses from families and members of the community. In addition to students most impacted by the pandemic, 90% of the survey respondents identified those who experience historical racial inequities, students of low-income families, students of color, English language learners, children with disabilities, students experience homelessness. Because of this community conversations, we have allocated $533 million of the allocated dollars in ESSER. We firmly believe that investing on ARP to address learning needs is prudent despite the infrastructure and other investment needed in this district. We are hopeful that the needs can be remedied using the school construction in the Budget Reconciliation Act proposed by the House of Representatives. The circumstances were unprecedented. The needs are great. And now is time to shape a recovering benefiting our children, our community, our country, and the future. Thank you for giving me the opportunity to testify this morning.
Thank you, Dr. Jara. We will now hear from Ms. Fort. Ms. Fort, welcome back to the committee, and you have 5 minutes, please.
Good morning, Chairman Sablan, Ranking Member Owens, Chairman Scott, and members of the committee. My name is Denise Fort, and I'm the interim CEO of the Education Trust, a national nonprofit research and advocacy organization dedicated to closing opportunity gaps in education that disproportionately impact students of color and students from low-income backgrounds. As noted, I was also a congressional staff member for 20 years, most recently as the staff director for this committee. So it's truly an honor to return to the committee today. And in my other full-time job, I'm the proud mother of 2 sons who attend public schools right here in DC and are experiencing firsthand the return to school after spending a year at home in virtual settings. Today, I'm pleased to share the Education Trust thoughts on how we collectively can address the longstanding inequities that we know existed before COVID-19 and have grown, how we support student and community voice, and implement evidence-based and equitable solutions to ensure student success. As this school year is underway, district leaders, educators across the country are working hard to meet the needs of students, families, and staff using vital American Rescue Plan funds. The Education Trust has spent the last 18 months working with advocates from civil rights, disability rights, business, education, and parent communities to center their voices in the community in the recovery effort and highlight promising actions taken by states and districts. Today, we are urging state and local leaders to take these actions. First, state and school district leaders must address the immediate needs of educators, students, and families. Parents understand that in-person learning is preferable. However, many families of color, including Black families, have reasonable mistrust toward our public school and public healthcare systems. Trust between school leaders, community members, and parents is the foundation of a strong and safe school community and maximizes student outcomes. Leaders should actively inform and invite conversations with families. Trust is also built when districts and schools marshal their resources to provide safe in-person learning through adequate testing and contact tracing, upgrades to replace faulty and out-of-date ventilation, and basic public health protocols such as mandatory masking, distancing and hand washing, and obviously access to COVID-19 vaccinations. Second, states and school districts must ensure that funding is used equitably to address students' social, emotional, and academic development. Beyond addressing the immediate physical needs of students, educators, and staff, we must do everything in our power to ensure that children reach their highest academic potential and overcome the devastating year and a half of unfinished learning. Our research indicates when implemented under the right conditions, there are two strategies that are most effective to accelerate learning: targeted intensive tutoring and expanded learning time. We also know that strong, positive relationships with teachers and schools can dramatically enhance students' motivation, academic engagement, and social skills. In close partnership with a diverse and representative set of stakeholders, states should support districts and schools to identify and implement evidence-based strategies to accelerate student learning. These efforts should include high-quality statewide summative assessments to help target additional resources, professional learning opportunities for educators to ensure students have the opportunity to reach high standards, and additionally, strategies for leveraging school-based teacher leadership, distributed leadership, and innovative staffing models to provide supervision and support to tutors and teachers. Additionally, they can and should invest in high-quality, culturally responsive instructional materials that teach the truth about the history of this country. We call upon states and school districts to provide clear and accessible information about how they are spending these precious relief dollars. Finally, states and school districts must ensure that funding is used to lay the foundation to address the inequities that were exacerbated by COVID-19. State and local leaders should be planning for how ARP funds and other resources can yield lasting structural change. Congress should support these efforts in a variety of areas, including passing legislation to increase equitable access to early childhood education, advanced coursework, home broadband, strong and diverse educators and school meals, eliminate discriminatory school discipline practices, and incentivize states and localities to make their funding formulas more equitable. In closing, the Education Trust looks forward to assisting state and local leaders, Congress, and the administration in deploying resources in equitable ways that address the needs of underserved students and close opportunity and access gaps. Thank you for the opportunity to speak with you today, and I look forward to taking your questions.
Yeah, thank you, Ms. Ford, for your testimony. We will next hear from Mr. Zeig. Sir, you have 5 minutes. Thank you. I think you're muted, sir. David, you're muted. We can't hear you. You have to unmute. We really like to hear your testimony. Okay, let's move on to the next witness, David, and then we'll come back to you because we do.
Here,
Well, you,
Okay.
there you.
I switched.
Thank you. 5 minutes, sir. Thank you.
Oh, is it me now? Okay. Good morning, and thank you, Chairman Sablon, Ranking Member Owens, and members of the subcommittee for inviting me to testify today. Since the spring of 2020, I have been researching and writing about the nexus of kids and schools and COVID. From the beginning of the pandemic, I've looked not only at the circumstances in our country, but critically contrasted them with the circumstances surrounding and the policies affecting children and schools in other countries. In late April of 2020, schools began reopening in much of Europe. Roughly a month later, their schools remained open as the education ministers from 22 EU nations convened, and it was reported that open schools were not causing an increase in cases. Yet, in America, schools stayed closed for the duration of the academic year. That spring set the tone for much of America's approach to children and schooling for the rest of the pandemic. Today, we are seeing similar patterns play out in many of our schools with excessive mitigation measures, where, once again, the U.S. differs greatly from most of our peer nations across the Atlantic. Since, at least right now, there is general agreement that schools should be open, the relevant discussion is how they should remain open. One issue is quarantine protocols that repeatedly send great numbers of healthy children home for days or for more than a week at a time. Instead, schools should consider employing test to stay. In this program, if a student is exposed at school, they get tested, and if negative, they continue to attend school. A large study of more than 200 schools in England found that quarantining students offered no benefit over test to stay. This program is also preferable to routine surveillance testing, considering the latter's onerous costs, logistics, and the high potential for high rates of false positives. Some countries are not employing either practice and are simply following the classic advice of, if you're sick, stay home. The most charged topic in the US, and one that I've extensively researched and written about, is student mask mandates. Recently, the CDC released 2 studies which concluded that mask mandates correlate with lower case rates in schools. The studies, however, have major limitations, among them not accounting for vaccination rates among staff and eligible students, nor accounting for changes in community rates. Conversely, the CDC published a large comparative study earlier this year of more than 90,000 students that found no statistically significant benefit of student masking mandates. But debating conflicting studies on mask mandates distracts from and undermines confidence in the tools that we know work, such as fresh air and vaccinating the adults around children. The World Health Organization advises against masking children under age 6 and recommends masks on kids aged 6 to 11 only under certain circumstances. The European Center for Disease Prevention and Control does not recommend masks for primary students at all. Yet the CDC recommends that all American children, starting at age 2, wear masks in school. To be clear, millions of children in Europe are not wearing masks in schools. Yet there is no evidence that kids in Europe are at a greater risk of severe illness or bad outcomes, or that their surrounding communities are at a greater risk than their counterparts in the US because of this policy. We should ask ourselves why so many nations in Europe and elsewhere have already settled this issue from a policy perspective. They don't make kids wear masks. Why do we? Masks are not a benign intervention. They interfere with language acquisition, reading comprehension, and socio-emotional development. Quite simply, seeing faces is a fundamental part of how humans, and especially children, connect and communicate with each other. None of us knows what the impact will be, nor what it is like as a child to wear a mask all day, every day, for years on end. More broadly, to what end are we implementing all these interventions in schools? COVID, as has been known since the very beginning, thankfully, poses very limited risk of severe disease to almost all children. There's much to say on this specific point, some of which I detailed in my written testimony. Risk averse does not mean doing everything possible or conceivable to mitigate the spread of a virus to kids. Rather, we are trading the risk of one harm for the amplification of risks from other harms. Keeping kids home, alone in their bedrooms, glassy-eyed in front of screens all day is not, quote, playing it safe, nor is preventing them from seeing their friends' smiles or their teachers' faces. For a few weeks, this was no big deal. But now, in academic year number 3 of the pandemic, we need specific metrics for when these interventions on children can end. The reason school policies in European nations differ from ours is not because they have, quote, beaten the virus. It's because they are, and have been, interpreting the data very differently from our public health officials. I urge the members of this committee to ask the CDC to provide specific, evidence-based reasons why its masking guidance differs so dramatically from that of the World Health Organization, UNICEF, and the ECDC, and why our nation's school children have dramatically different burdens imposed upon them relative to their European peers. Thank you.
Yeah, thank you, Dr. Jha. And finally, Mr. Zeig, thank you. And finally, we will hear from Dr. Jha. Dr. Jha, please unmute your microphone and you have 5 minutes. Thank you very much.
Great. Good morning, and I hope you can all hear me okay.
Yes.
Chairman Sablin, Ranking Member Owens, Chairman Scott, thank you for having me here. Approximately 20 months ago, we confronted a novel disease we knew almost nothing about. Today, about 20 months later, we know how the virus spreads, and we have developed all the tools we need to end this pandemic. But because we have failed to apply that knowledge consistently, too many Americans continue to get infected and ill across our country. Today's focus is on COVID and kids in schools. Throughout this pandemic, the risk for kids has been consistently minimized, based largely on the fact that children are less likely to get sick than adults. This is, of course, true. It's also the wrong comparison, because basically for nearly every disease, kids always have better outcomes than adults. Whether it's COVID or flu or even cancer, kids have lower mortality than adults. The question isn't, are kids at lower risk compared to adults? The question is, how does the risk of COVID in kids compare to other risks that children face? And with that lens, it's clear that COVID is an important challenge. Over the past year, COVID has been one of the top 10 causes of death in kids among, one of the top 10 causes of death among American children. So while the risk is low, we cannot and should not be cavalier about its short-term or long-term effects. Now, the risk of COVID in kids and staff has led many school districts to remain remote for much of the last year. The harm done by closed schools has been well documented today by other experts, and I'm not going to go through it, but it is very clear that closed schools are very, very harmful to children. And in our hyper-polarized country, some have chosen to highlight the very real cost of keeping schools closed while minimizing the risk of COVID in kids. Others highlight the real cost of COVID to kids and minimize the cost of closing schools. We need to do better. Less polarization, more focus on children. And here's the good news on all of this. We can do both. During the past 20 months of studying SARS-CoV-2, and from decades of studying how airborne viruses spread, we know how to keep students and staff safe in schools. There is broad consensus among experts, both in the US and around the globe, that we must take a layered infection prevention approach. So what is that? Vaccinations, ventilation and filtration, and I'll go through each of these a bit more. Regular testing and tracing, universal use of masks, and avoiding crowds and promoting personal hygiene. No single layer is perfect, but implemented together, they can make a big difference. Now, of course, each school and each community is different. And that means school districts must invest in strategies in ways that allow them to implement these strategies, taking those local context factors into account. One key approach is that schools or school districts need to develop school-based teams who are focused on keeping schools safe. Now, I want to talk about what the barriers to implementation of these strategies have been. There are many obstacles, but perhaps none is more daunting than the misinformation and disinformation that is undermining public confidence in the scientific evidence. Here's some of what that evidence tells us. Vaccines are the most effective weapon we have in this pandemic, and schools should require all adult staff to be vaccinated and should strongly encourage kids who are eligible to get vaccinated. Masking makes a difference. It is puzzling to me that some people think it wouldn't. This is an airborne disease spread primarily through aerosols. Masks slow the spread of aerosols and reduce their inhalation, albeit imperfectly. In study after study, the data suggests that masking reduces spread. No single study is perfect. One can look at the dozens of studies and find holes in every one of them. But that's not how evidence-based decision-making works. As a doctor, I am confronted with dozens of clinical questions where the data are not perfect. I look at the totality of the evidence. And from the totality of the evidence, the data is very clear. Masks for children is helpful. We know testing is critical. Testing students and staff, regardless of symptoms, allows schools to immediately identify cases and prevent large outbreaks. And we know that ventilation and filtration make a very big difference. This can be as easy as opening windows and doors, but also requires upgrades in air filters and ventilation systems. Thankfully, federal funding has been provided through the ARP for these critical upgrades, investments that will help end the pandemic. But better air quality will have long-term benefits as well, improving cognition, mood, preventing the spread of other infections. This is a really smart investment for our kids. So in conclusion, for all the progress we have made as a nation, there is a lot more we have to do to confront the challenges of this pandemic. It is imperative that we act on the knowledge we have gained and use all of these measures to keep kids and staff safe in schools. If we do these things, we can get them back safely, we can end this pandemic and build resilience against health threats of the future. Thank you.
Thank you, Doctor. Thank you very much. We will now move to member questions, move on to member questions. And under Rule 9A, we will now question witnesses under the 5-minute rule. I will be recognizing subcommittee members in seniority order. And again, to ensure that the members' 5-minute rule is adhered to, staff will be keeping track of time and the timer will show a blinking light when that time has expired. So please be attentive to the time, wrap up when your time is over, and remute your microphone. As chair, I now recognize myself for 5 minutes. Superintendent Zara, numerous studies show that lost instructional time has impacted student learning and exacerbated pre-existing achievement gaps. The American Rescue Plan requires that school districts use at least 20% of their funds to address lost instructional time by supporting students' academic, social, and emotional needs. And I was really encouraged, greatly encouraged to see that Clark County School District is exceeding this reservation and using 80% of its American Rescue Plan funds to address hearing loss. I am rather envious, Superintendent. So, Superintendent, can you share the evidence-based interventions that Clark County Public Schools are using to support student learning this school year? And how is Clark County School District ensuring those interventions are targeted to meet the needs of student groups most impacted by the pandemic, such as students of color, students from low-income backgrounds, and students with disabilities and English learners?
Chairman Sablan, Superintendent Jar, for the record, again, thank you. First of all, let me just thank Congress for the allocation of the resources that have been provided. I think it's a historic investment in K-12 education. So really appreciate as we're moving into this direction. As I mentioned in my testimony, this was something that was important for us as a community to really allocate time for community input. As we faced and moving into an improvement after we stabilized this community and our children, one of the things that was very clear was the loss in learning, and as an opportunity for us to move forward. So the allocation of resources to support our kids really was research-based, but a community input. We brought into our students to re-engage in summer accelerations. I heard in your opening remarks, a lot of our school systems brought in their kids in this summer for summer acceleration, re-engaging into our schools. So we're looking at expanded learning opportunities, really investing in our educators on professional learning. We're proud of the work around mathematics across the entire district, our English language learner. All our teachers, 18,000 educators, had the opportunity to participate in learning. Lowering the ratios for safe professionals are included in the plan to bring in hire more social workers, including counselors, implementing high quality math instruction, professional development as well for our educators, instructional materials, purchasing really some of this personalized opportunities for our kids in programs, not only through technology, but also manipulators and face-to-face. And then we have a huge chairman and members of the subcommittee, we have an investment in early childhood. We know that our children, the earlier that we get them in our schools, I would say the better chances we have in really eliminating some of the gaps. So there's a huge investment as we're looking at as well in our early childhood, early literacy for our teachers and our educators. So thank you, Chairman.
Thank you, Superintendent. Ms. Forte, let me try and get this one in. Education advocacy and civil rights groups have called on the Department of Education to ensure that as we restart accountability systems as required under the Every Student Succeeds Act, these systems are equipped to identify low-performing schools and direct additional support and resources where they are needed the most. So how can the Department of Education support states in improving their accountability systems to ensure that federal resources are supporting these schools and addressing the resources inequities that students of color and low students' incomes face? Ms.
Chairman
Fordham,
Sablan,
we
and
have less than half a minute.
yeah, thank you for that question, though. We can't go back to a time where all this data was hidden, and that is why accountability systems have been so important. The department plays a critical role in supporting states to develop and implement these systems that actually drive additional federal resources to schools to address resource inequities. And in order to have a robust set of student opportunity and outcomes, we do need a full picture where students have equitable experiences. And states really have to be the first ones to be able to collect and provide that transparent data. Hopefully the department can reiterate through guidance or technical assistance that states and school districts use funding from the ARP to invest in robust P through 16 data systems.
Thank you. Now, Ms. Ford, we're out of time, but if you could please provide us greater detailed response to that question, I appreciate it. Thank you very much. And I now like to recognize the ranking member, Mr. Owens, for his questions. Mr. Owens, you have 5 minutes, sir, please.
Thank you, Mr. Chairman. Mrs. Zugg, in your testimony, you discussed one of the most critical issues we face in this debate, which is the number of students being quarantined and the length of those quarantines. Los Angeles County released data 2 weeks ago showing that only 0.2% of the students and staff in close contact in schools subsequently tested positive. This seems to demonstrate an extremely low level of COVID spread in the school systems in Los Angeles County. How should this inform the debate about quarantine?
Yeah, that's an important question. And as I noted in my initial statement, one of the best ways I think to address this is to use a program like Test to Stay, which is shown to be really effective and successful at not quarantining kids who are healthy and keeping them home, yet also keeping the school safe at the same time. If there's a child who's exposed to someone who was infected, you test that child. If they're negative, send them back to class.
Very good. I'm going to continue with you, asking you, several states have prohibited their school districts from implementing universal mask mandates in their school districts, and those states have been criticized and investigated by the Biden administration. Do you believe local school and public health officials have sufficient expertise to make policy decisions about COVID mitigation strategies without state guidance?
Yeah, it's interesting. I've interviewed superintendents from the tiniest school districts to some of our largest cities in the country, and every single one of them has told me, I am not equipped to make these types of decisions. They lack epidemiological and infectious disease expertise. These are education professionals. So time and again, they have almost been begging to have more guidance from above, particularly from their state government, saying, you need to do X. And that way it frees them up. And then they just follow the guidelines of state health departments that actually do have the staff, that do have the expertise in these healthcare matters, rather than sort of punting it to people where this is totally outside their wheelhouse.
And one last question. Two of our other subcommittees had a joint hearing yesterday examining ways to protect the health of communities from COVID-19. Among other things that the hearing looked into specifically was the disproportionate impact of COVID-19 on communities of color, which you argue that the country's mitigation strategies in schools have reduced or exacerbated or increased the disproportionality of COVID's impact on our communities at risk.
Yeah, there's an extensive amount of evidence and data and studies that show that those people with the least resources, in particular in relation to schools and education, have suffered the most, whether it's from school closures, because those children at home may have family members who are unable to help them with work, versus Families with more resources can hire tutors, or maybe one of the parents is home. So from school closures have been really damaging to them. And even things like mitigation measures within the schools are more damaging. An example might be where you have a child who perhaps their family are English language learners and the parents are not able to help them read at home, and it's a kindergartner. And when they're in school, their only opportunity for learning how to read is while they are wearing a mask and the teachers are wearing a mask. Whereas other students, they can go home, there's no mask, they have tutors, etc. So these are just a couple examples. I mean, this is what we see play out in society at large, is that the people with the fewest resources, unfortunately, often bear the greatest brunt of the burden of these types of mitigation measures. And the education and school system is no exception to that problem.
Thank you. Thank you so much. Chairman, I yield back.
Yeah, thank you, Mr. Owens. I now like to continue on with member questionings, and I'd like to recognize one of my favorite teachers, Ms. Hayes. Mrs. Hayes, 5 minutes, please.
Thank you, Chairman Sablan, and thank you so much for having this hearing, and to all of the witnesses for being here to continue this important conversation on this critical issue. My governor has issued guidelines that require masks to be worn in schools for school bus drivers and at child care facilities. And he recently implemented in the state of Connecticut a requirement that all school personnel be vaccinated or require testing. This is a decision that is not made lightly. It is made for the health and safety of our children. I want to emphasize that this measure underscores Connecticut's efforts to reopen schools safely and in person, something that we struggled with as a nation all of last year. So we are taking those measures in conjunction with aggressive state vaccination efforts so that our children can learn at school full-time in person. Today, Connecticut's positivity rate is about 2.83%, which we are very proud of because we have taken this pandemic seriously from the very beginning. But there's still many challenges for breakthrough cases in our areas of highest need and our most vulnerable students. Earlier this year, the Department of Education issued an interim final ruling requiring that states and school districts meaningfully engage in stakeholder consultations and take public input into account when developing their plans to use American Rescue Plan funds. Ms. Forte, why is it important for school districts to engage a diverse and representative set of stakeholders in their reopening plans?
Thank you for that question, Congresswoman Hayes. The importance and criticality, honestly, of stakeholders can't be understated. It is critical that states and school districts meaningfully engage those who have a deep understanding of the school system and are most impacted by decisions made about the state's education system, including students, families, educators, district leaders, service providers, community members, and advocates. We have seen when strong stakeholder engagement is present that they are able to direct funds in a more equitable fashion, and we know that the voices are being heard. This engagement should be part of a very sustainable feedback loop that allows students, families, community members to both provide input on initial plans, but also feedback as they're implemented.
Thank you. And I don't come to this conversation from a lack of perspective. So many people talk about their district open without problems. I am a representative for Connecticut's 5th District, and we have some of the largest equity gaps in the nation. I have some of the highest performing schools in the world and some of the lowest performing schools in the country that are literally 5 miles apart. During my time as the National Teacher of the Year, I traveled districts all over the country and all over the world, and they are not all created equal. So the fact that people believe that just because one school district was able to open immediately and effectively, because they might have had the physical structure, the broadband, the supports already in place, does not mean that that is the mechanism or the measure by which we can evaluate every district. Dr. Jara, has your district engaged families, and particularly families who have been the most impacted during this pandemic, in your district planning for reopening to meet the needs of children?
Great question. Representative Hayes, yes, we did. But actually, when we started reopening, we brought in, I instituted a reopening plan, obviously not only our bargaining units, but all our community. As somebody who came into this country, didn't know, not knowing English is one of the things that I always said, if my mother was educating me now, how would you be able to do that? We did participated. I was made available, I made myself available to Nevada PTA town halls, all our advocacy groups to really look at ways to address and open schools safely. So yes, we did across the entire community. I'm going to tell you, we've opened schools. It hasn't been, as you mentioned, we have some of the largest inequity equity gaps as well. And it's been not without a challenge, but the commitment to keep our kids in school has been great from this entire community. So thank you.
Well, thank you. And thank you for just re-emphasizing and reiterating our commitment to keeping our children in school, but also the fact that that has to be done safely. It is incredibly disheartening that on this committee in the highest halls of Congress, we are still even having a discussion that I think is something we should all agree on. We want our kids to be safe, and it is our responsibility to protect them from all harm. Based on the data and the information that we have. Again, thank you all so much for your thoughtful answers. Mr. Chair, I yield back.
Yeah, thank you very much, Mrs. Hayes. Now I would like to recognize Mr. Grothman, please. Mr. Grothman, you have 5 minutes, sir.
Thank you. Mr. Zweig, I don't know if I'm pronouncing that right. At a different hearing yesterday, one of the witnesses testified Congress should consider tying funds to doing what the CDC wants. Apart from the fact that the CDC has gotten so much wrong already here, given the degree of disagreement in the scientific community about the CDC's recommendations, would that be a wise step to take? Just to say you got to follow CDC?
I think it's a terrible idea, and I'll give you an example why. The CDC for a very long time was recommending 6 feet of distancing in the schools. However, a number of states were not complying with this guidance. Ultimately, in Massachusetts, they performed a study and they found that 3 feet of distancing was no worse than 6 feet of distancing. Had all of the states in the country lockstep complied with this 6-foot guidance, there never even would have been the opportunity to test this out. It's only because Massachusetts didn't go along with the CDC's guidance that scientists and experts were able to perform the study, and lo and behold, there was no benefit of 6 feet rather than 3 feet. After the study came out, the CDC shortly thereafter changed its guidance away from 6 feet down toward 3 feet. So that's just one example that we can't know what's happening unless states are given the opportunity to test different things. The CDC is an important and wonderful organization, but they're not infallible. So I hope this example at least gives a sense of why that's important.
Well, I'm glad the state of Massachusetts had the guts to stand up to them. Obviously, different countries view things differently. You talked about different states viewing things differently. How did the United States response compare to, say, the European response or other peer countries as to how they dealt with the COVID with schools?
As I mentioned in my opening statement, I think one of the biggest differences is that in Europe, and this is in many different countries with different cultures and different rates of cases and mortality rates and et cetera, one of the unifying factors is that they really prioritize keeping schools open. So this is in direct contrast to somewhere like California and some other areas where kids were out of school for a full year in many instances. So there's this kind of 30,000-foot view where schools in a lot of these cultures, where they said this should be the last place to close and the very first place to open. There were a number of academics and scientists in America who argued for that policy, but it obviously was not followed throughout the country. And then, as I mentioned, that sort of overarching philosophy, you could then see play out with a variety of other measures, whether it's with masking and other interventions. There is this sort of philosophy of priding normalcy for children over a sort of what at times seems to be a hyperbolic kind of a security theater, whether it's the plexiglass, between the desks and things of that nature.
Okay. give you another kind of general question. Some of my colleagues, when they talk about opportunities for students, seem to talk primarily about income level, and this is a little bit, do you believe income level of parents is the most important thing in how you raise children, or are there other things more important? Maybe that's an unfair question to ask you, but I don't think it is.
I'm sorry, you're asking me if an income level is the most important factor in how children are being raised?
Right. I mean, the implication from some of my colleagues, I found a little bit offensive to imply that if you don't make a lot of money, you can't be a good parent, or that if you make a lot of money, you're automatically a good parent. I tell you what, I'll switch you and give you another question.
Sorry, yeah, I would disagree with that notion. I do not.
Yeah, I find it offensive when people imply that.
Okay.
You mentioned in your statement that you've been researching and writing about children's schools and COVID since the beginning of the pandemic. Could you give me a general sense of the type of people you've talked to gain the level of expertise you have?
Sure. One of the things that's fun about being a journalist is I get to talk to everyone. So I now have a virtual Rolodex in my phone of infectious disease specialists, epidemiologists, immunologists, pediatricians, superintendents from schools. So that has enabled me to have a really kind of wide angle lens on seeing the issue of kids in schools and COVID from a whole variety of perspectives that someone who perhaps is an academic in a particular lane stays in that lane and lacks this sort of a larger perspective that I hope that I've been able to bring to myself by talking to so many different people on a regular basis.
You've been very enjoyable. Now my 5 minutes is up.
Thank you.
Yeah, thank you. Thank you. And if we start counting on what we take as offensive, we'll never get anything done. But we're entitled to our own opinion. So I'd like to now recognize Mr. Yarmouth, the chairman of the Budget Committee. Thank you very much. You have 5 minutes.
Thank you very much, Mr. Chairman, and thanks to all the witnesses for being here today. In relation to that last comment, I didn't hear any of our members talk about the subject that Mr. Grothman raised. As a matter of fact, the only discussion I heard at all about income disparity was from the Republican witness. So I don't know where that question came from, but moving right along, Ms. Fort, your organization did a poll in New York State of families there, and it indicated that while families overwhelmingly wanted their kids to be in the classroom in person, they still had reservations about health and safety issues, particularly and understandably with Black and Latino families. My district in Louisville is 96,000 kids. It's majority non-white, and I know that we have a lot of that situation in my district where parents are very wary of sending their kids to school. In your report, were you able to deduce any strategies for convincing Latino and Black families of the necessity and the safety of sending kids back to school?
Oh, what'd you do?
Thank you for that question, Congressman. At the heart of the matter for many families of color in terms of returning to school was over the past year and a half, many of them were able to experience school with their students and saw firsthand what the classroom looked like, even though it might have been on video in a virtual setting. And many students of color continue to face a lot of microaggressions. They're being over-disciplined, even in a virtual setting. So one of the things that parents are asking for is how school leaders, how district leaders can go about that return to school with a lens that really addresses the socio-emotional and academic well-being of their students. And there are a variety of solutions to go about that. One is making sure students have strong relationships in the school building with the principal, with the teacher, with the tutor. There are a number of schools, including my son's, who take advantage of city year programs and service learning so that children have more opportunities to build strong relationships with adults in the building. The other thing we do know is that we need to start embracing our children from an asset perspective, meaning they all come to school with their own strengths, and we need to empower them to see those. But again, going back to the idea of strong relationships in the school system, that's what parents are hoping for. They want to make sure that their children, when they return to school, are safe and secure and are welcomed.
Thank you very much. Dr. Jha, I know that those of us who spend far too much time on MSNBC are very familiar with you. I suspect that my Republican colleagues are not as familiar with you, but we're honored to have you here, and thank you for your work throughout this pandemic. I was intrigued by your testimony talking about the layered technique and the fact that there are some elements of the strategy, the layering strategy, that actually have benefits beyond the just dealing with COVID, particularly the ventilation issue. We put a lot of money in the American Rescue Plan to deal with those kind of upgrades. Can you elaborate a little bit on how important this is to fund remediation of ventilation systems in schools?
Yeah, Congressman, thank you for that question. And indeed, there is very, very good evidence that improving ventilation makes an enormous amount of difference. This is an airborne disease. And as such, things like wiping down surfaces or plexiglass, not so helpful. For the pandemic itself, we've got to clean the air. That's got to be the strategy. But what we knew before the pandemic, Congressman, is that poor quality ventilation had profound effects on cognition, on mood. And that's why companies had been making big investments in really having high quality indoor air. It should be something that should be available to all of our children, all of our colleagues in schools as well. So I think the American Rescue Plan opens up an opportunity to make smart investments in substantial upgrades in ventilation and filtration. And if we do, it'll help end the pandemic, but it will have long-term benefits for our kids and the people who work in schools. And obviously that's clearly a good investment for us to be making.
Great, thanks for that answer, and I yield back.
Yeah, thank you very much, Mr. Yarmouth. Thank you. I'd like to now recognize the former ranking member of this subcommittee, Mr. Allen. Mr. Allen, you have 5 minutes, sir.
Thank you, Mr. Chairman, and it's thank you for holding this hearing. It's very important that we get to the bottom of this issue and the truth of this issue, and it's like I said, it's and I think we all agree it's for the children and their best interest. I will say that when it comes to reopening schools, the 12th District of Georgia, the district I represent, we work very hard to get our students back in the classroom, but also give parents a choice, whether they were in person or virtual. Across mostly rural, the mostly rural district, I talked to many parents in public and private schools who were committed to sending their children back in person. Columbia County school system is one of the largest in my district, and it was the first to reopen. A smaller private school, Heritage Academy, which is a school for low-income students, took action to install the industry-recommended air ionizers and to keep an open line of communication with parent to ensure they would monitor their child's symptoms. This led to 100% buy-in in staff and parents and fully reopening. One of the largest districts in Georgia, Richmond County School System, addressed reopening concerns by giving the students and the parents the choice and the learning equipment they needed for long-term use, whether they chose in person or virtual. As far as the Mr. Zewig, I hope I pronounced that correctly. As you probably observed, families across the country, especially low-income and working parents, face significantly more challenges when schools are not fully open. What advice can you offer to decision makers who are weighing being risk averse and trying to do what's best for their children and the teachers for their students?
Well, obviously, every community is going to have a different degree of prevalence of COVID at different times, and that will influence the decisions of any education professionals, in that particular community. But I would say that, and you're going to probably hear a theme that I'm going to touch on a lot today, that there's this sort of broader view that's worth bearing in mind. And then the notion that closing schools and keeping children home is, quote, safe, that's the best thing to do at all times, I think is very misguided. And again, we have a real world observational evidence in front of us taking place throughout Europe, where they have been conducting themselves quite differently than a lot of America as far as keeping kids in schools, as far as not burdening them with excessive mitigation measures. It's not that they don't care about children there, I'm quite certain. It's that there is a different approach to what is safe and what does that mean. And they understand that doesn't specifically mean keeping children home or doing everything you can or perceive that you can do against a virus versus being aware of a variety of other harms and illnesses that can come to children.
Well, let's be honest here. A lot of this was created by special interests and their influence over not only the Biden administration, but over many of our school systems across the country. How did, how has special interest caused more confusion and clouded the science that other countries are relying on more? How are they dealing with it?
Well, as I'm sure everyone has seen, there certainly were reports that came out in the media regarding teachers' unions having private conversations with members of the CDC. However, the CDC has said, which is appropriate, that they have met with a variety of stakeholders. So I think it does make sense and it is appropriate. Teachers are important stakeholders, but other stakeholders should be involved in these conversations as well. And I would sort of broaden that statement to say that part of what we need to look at is not just infectious disease or viral mitigation, but broader concepts about what makes a flourishing childhood. We don't want our children to be in danger, of course, but we also want to look at this from a much larger, more holistic perspective. Again, and we're seeing this play out in a variety of other places.
Great. Well, thank you very much. Again, you've been very helpful. And Mr. Chairman, I yield back.
Together here. All right, there we are. Well, thank you, Mr. Allen. Ms. Wilson, Federica, you now have 5 minutes, please.
Thank you so much, Mr. Chair, for holding this hearing today, and thanks to all of the witnesses for appearing. All across America, millions of students are returning to their classrooms for the first time in more than a year. The time they spend away and how districts make up for it will have significant and lasting consequences. McKinsey estimates that this generation may earn roughly $50,000 to $60,000 less over their lifetime. Many students have entirely fallen between the cracks and may never catch up. According to Bellwether Education Partners, up to 3 million students have become totally disconnected from the education system. Thankfully, districts have the resources to address these challenges. Congress has invested roughly $200 billion to help schools safely reopen. However, officials in my home state of Florida and several others have put politics above public health. Our Governor DeSantis has fought to stop districts from implementing mass mandates while the Delta variant surges across our state. People in my district die every day. We have lost dozens of teachers in Florida. DeSantis is failing to protect Florida students and educators and endangering our state's recovery and the safe reopening of schools. Florida is the only state which has not submitted its ESSER plan to the Education Department to claim it's all of its relief funding. I have a few questions. Dr. Jara, as the Clark County School District uses their ESSER funds to invest in the children, Are you considering equity in education and the funding for Black and Hispanic children and Black teachers specifically? And are you working closely with your federal delegation?
Representative Wilson, great to see you, obviously, having grown up in Miami-Dade County Public Schools. So yes, we are. Obviously, the equity as a minority majority district here in the Clark County School District, yes, we are. That's why we partner with our nonprofits to really, for the community input as we've opened schools. So that's number one. And my delegation is very involved in communicating and working of our ESSER 3. And they have been really tied at the hip with us in making sure that we are providing the resources to where the greatest need, and appreciate the question, Representative Wilson.
What strategies is Clark County School District using to find and re-engage missing students?
Yeah, thank you, Representative Wilson. One of the things that our governor really created a task force right away when the pandemic started, which was a public-private partnership. And we partnered together, and it was critical here. And we started connecting our kids and going out into the community. And then we reshuffled, and as I heard earlier, we had to change. We're educators, but we had to learn as superintendents, as educators, and what we needed to do, and partnering with the county, with the Southern Nevada Health District to keep our kids safe and being in school. So yes, we had to reshift our work. Our truant officers became truant attendance navigators. Our principals went out and sent community into our schools, knocking on doors, doing wellness checks to connect with our kids as they couldn't come in. We had to connect at their homes. We also, our summer program, bringing our children, re-engaging them in schools. So all of that work that we went pretty much out into the community has, proud to bring our kids. We have over 304,000 of our children in our schools, and then also provided choice. Our kids are also in Nevada Learning, giving our parents an opportunity to re-engage. So multitude of modalities to then making sure that our children were in school.
Thank you so much, Dr. Jha. It's a pleasure to have you here with us. This is quite an honor. Mask. Why is it important that local education leaders can draw on this tool to respond to spread in their community? I heard you say that you think vaccinations should be mandated, but in addition, masks.
Absolutely, as Dr. Jha, there's multitude of strategies, and I'll just tell you,
Doctor, no,
oh.
For the physician.
It's the problem of having names that sound very similar. Congresswoman, thank you for your question. I'll be very brief because I know we're out of time. Look, the data on masking overall on humans is overwhelming. It's very, very clear that masks help, and it makes all the sense in the world. This is an aerosol disease, airborne disease. Of course, masking is going to help. Children are going to be able to do this as well. I know I'm over time. Thank you, Congressman.
Thank you, Dr. Jha. Do you please feel free to submit your response in writing for the record? We really appreciate that. Thank you.
Mr. Chair?
Yes.
Congresswoman Wilson, I have questions that I'm going to submit to the committee.
All right.
The witnesses can respond in writing.
Yes, yeah, please do that. Thank you. And now I'd like to recognize, let me see, Mr. Keller, the gentleman from Pennsylvania. Sir, you have 5 minutes.
Thank you, Mr. Chairman. As America's schools start their new academic year as recently as several weeks ago, today's hearing is incredibly important. Having America's children safely return to school, back to full in-person instruction, is a goal of every member of this committee that we can all support. It is widely accepted that students' learning suffered during the 2021 school year. A recent study conducted by McKinsey and Company found that the impact of school closures on learning loss was significant, leaving students on average 5 months behind in math and 4 months behind in reading by the end of the school year. Even now, we are still not back to full in-person learning, despite the fact that those vulnerable to COVID-19 have had the opportunity to receive a vaccine, and risks to K through 12 students remain minimal. school closure policies, along with requirements such as mask mandates, are problematic for students, particularly those with disabilities. The decision to keep students out of school and whether or not to wear masks is best made by parents and families relying on the latest public health guidelines in coordination with local school boards. Mr. Zug, thank you for your testimony and for being with us today. The World Health Organization advises against requiring students with disabilities to wear masks. Can you tell us why they made this recommendation?
Thank you for the question. I can't speak for the World Health Organization specifically, but what we do know is that there are a variety of kids who have special needs, whether it's some autistic children, whether it's some children who have sensory issues, and a variety of other sort of issues and challenges that certain kids deal with. And masks can be very problematic for them. I've interviewed numerous teachers, as well as other education professionals, as well as psychologists who work with autistic children, and they have all talked about how challenging it is and harmful it is for some of these children. They simply cannot keep the mask on. So that's something bearing in mind, and that's part of the reason. I think the other larger picture here is bearing in mind the age stratification of risk. And it is so wildly disproportionate, tilted toward older people, that there have been a number of polls that have shown that a lot of Americans drastically overestimate the risk to children. This isn't to say there isn't danger posed by COVID, only that we generally have a very wrong understanding of how that risk relates to other risks that confront children.
And thank you. And I'd just like to follow up with you on another question. The Biden administration has supported universal masking in schools. What challenges exist with mask mandates in a school setting? And what has your research shown about the return on investment of such a difficult to implement policy?
Yeah, the evidence for masks is mixed as far as specifically related to masking mandates of students. I agree with Dr. Jha. Of course, there is great evidence that some masks work on some people in some circumstances, but there's a very big difference between a healthcare worker wearing a fit-tested N95 that's extremely tight on their face, where a millimeter of air is not going to get around the edges, versus a child wearing a cloth mask that their parents bought off of Etsy or Amazon. And we've seen this borne out in the data. Like I mentioned earlier, one of the CDC's own studies did not find a statistically significant benefit of the student mask mandate compared to schools that didn't have a student mask mandate. And to this point, a number of experts, including Michael Osterholm, Celine Gounder, these are people who are on President Biden's COVID transition team task force. They have said publicly and clearly that cloth masks offer at best a marginal benefit. And that is the mask that most children are wearing. And related to that point is the notion of compliance. There's a study that came out of Marin County that the CDC put out, and it showed there were mask mandates, but guess what happened? The teacher pulled the mask down. There is a difference between mechanistic studies and how human beings behave in the real world.
Thank you. I appreciate that. And I think the benefits, and we can all look at that when it comes to our psychological well-being of seeing our friends, and particularly at a young age, seeing classmates smile at one another and have that friendly greeting that you can't do with a mask. So I think there's a lot of benefits that exist for our students and for us as adults when we can exchange that smile and have that camaraderie that a lot of students look forward to in school. So with that, I yield back. Thank you, Mr. Chairman.
Yeah, thank you, Mr. Keller. Since you're in the committee room, you can put your mask back on. Thank you. And now I'd like to recognize Mrs. McBath from Georgia. Mrs. McBath, you have 5 minutes, please.
Thank you, Mr. Chairman, and thank you so much for holding this very timely and pertinent hearing on examining how we can best assure that our children have a safe and enriching return to school this fall. And I also want to thank our witnesses for taking time today to share their evidence-based research and observations with all of us. And as students, teachers, and staff return to classrooms for the first full school year in almost 2 years, in many inter-school classrooms for the very first time, it's really essential that we ensure that they have healthy and safe environments in which to flourish, as well as the tools necessary to equitably address the academic and social needs that they are going to face. And I'm so proud to have voted in support of the American Rescue Plan, which provides states like mine, Georgia, critical funding to help reopen schools safely and help students make up for the lost time in the classroom. And my home state has actually received over 4.25 billion in funding. And it's imperative that school districts use these funds to help ensure that children, our teachers and staff have safe classrooms to return to, whether that be providing masks, free COVID testing, or updating ventilation and filtration systems, as we're talking about this morning. We've got to make sure that our children are healthy so that they are in the best position to learn and to grow. So Ms. Ford, thank you so much for sharing your testimony today. My first question is actually for you. The COVID-19 pandemic has truly disrupted learning for all of our students. Every one of us knows that, and particularly for students who had less access to quality educational opportunities prior to the pandemic. Acknowledging this, the American Rescue Plan Act provided the largest investment in K-12 education in history and required that states and districts use a portion of their funds to actually address the lost instructional time. So Ms. Ford, if you could please just tell us what evidence-based strategies should schools implement to address the impact of unfinished learning?
Thank you for that question. And also thank you for framing it in the way that you did in terms of unfinished learning. At the Education Trust, we don't believe in learning loss because students of all, from all communities really missed out on the learning as opposed to them themselves losing learning. The real issue here is we've looked at the research, we've done the research ourselves, and there are evidence-based strategies that schools should be using across this country that we know will impact and affect students and support their accelerated learning. We have to accelerate. This is not about remediation. We need to understand and invest in practices that will not only help students make up for unfinished learning, but accelerate. And students who are even surpassing grade level expectations must have opportunities to accelerate their learnings. So a couple of ideas that we've looked at and we've researched include intensive tutoring. That can be in small sizes with very low ratio for adult to students. We know that this also comes with the importance of professional development for those adults in the room. Expanded learning, expanded time, adding more time to the day, including making sure that that day is filled with whole child supports such as play for our early kids, or it could be music for adults. There are a number of ways that we can accelerate learning, and the research is showing that both intensive tutoring and the availability of expanded day is the way to go.
Thank you so much. And I know that I'm running out of time, but Dr. Jha, in your testimony, you described 5 steps that schools should take to safely reopen for in-person learning, including vaccination and also mask use, ventilation testing, and social distancing. These practices are aligned with the latest guidance from both the Centers for, or the CDC, and also the American Academy of Pediatrics. Why is it so important that schools use CDC guidance as a foundation for implementing COVID-19 prevention strategies to safely maintain in-person instruction this academic year? Thank you.
Please
So
make
Congresswoman,
Thank you.
Yeah, Congresswoman, it's a great question. Obviously, no agency has gotten everything right. CDC represents the best scientific evidence that we have to date. The American Academy of Pediatrics, our nation's pediatricians, are deeply engaged on these issues and are calling the scientific evidence. I think it's a great place to start, to begin with the CDC and AAP guidelines. and where they converge, I think this is where the school district should begin their work. Again, they're not going to get it perfectly, but they have been pretty consistently right on a lot of issues over the pandemic.
Thank you so much.
Doctor.
And my time is up. I yield back.
Thank you, Ms. McMahon. And now I'd like to call on Mrs. Miller. Mrs. Miller of Illinois, please, you have 5 minutes.
Thank you to the chairman and ranking member Owens, and thank you to all the witnesses. And I want to assure you that we do share your opinion that our children are not only an asset, but the greatest asset of our country. Mr. Zwig, a few other members, Ms. Wilson and Mr. Keller, have mentioned a study produced earlier this year by McKinsey and Company that found that the 2020-2021 school closures could have an annual negative economic impact of $128 billion to $188 billion once the affected students enter the workforce. Could you please explain why these school closures could have such a dramatic impact on the affected students?
Thanks for the question. Well, we've known for years and years now that there is a strong association between education, of course, and income as people move from being children to adults, and in beyond income. And then, of course, connecting the dots, income, connecting to access to better healthcare and other parts of participating in society. So if kids are home and not in school for a year, which has happened in a number of places in our country, that of course is going to have reverberating effects on these children's lives, potentially for years to come. And the reality is no one knows. No one knows exactly how this is going to play out. I had a really interesting conversation with a child psychologist who works on the staff of one of our large cities, staff of the education department, one of our large cities on the East Coast. And she told me about one of her students who is a minority student who was on her way to college. She was going to community college, first one in her family, but then schools closed. She wasn't able to maintain her job at Starbucks. She wasn't able to get online in her home because they lacked the resources. And now she's completely lost touch with her. So it's these sort of heartbreaking stories about kids who have really kind of slipped through the cracks, and not all of them, it seems, are going to be able to be brought back in the fold. I know educators are working as hard as they can, of course, to try to do so.
Thank you. Mr. Zwig, you also made the point that keeping kids away from schools or employing some of the mitigation strategies favored by the CDC should not be viewed as playing it safe, the playing it safe option. In other words, whether or not these policies have some marginal benefit, they are not without harm. Could you please elaborate on the harm you see from our country's policies?
Yeah, it's a great question. I would say kind of the broad view on that is that, of course, when we are confronted with an unknown threat, which certainly was COVID initially, as a precautionary principle, it makes sense to do everything you can to try to avoid sort of an unknown catastrophe. But as time played on and we watched what was happening, particularly elsewhere outside the United States, at a certain point, it's that not only the logistical right thing to do, but the ethical thing to do, I believe, to start shifting your priorities. That perhaps it's not appropriate to have an infectious disease specialist be the person who's directing the show for the duration. We have to ask, is mitigating a virus ultimately the same thing as human flourishing? And initially, yes, it is, because no one knows what's happening. But as more and more information has come in, and as we've seen a real world experiment play out with students in Europe who have been in school while kids here have been home, I think that provides very persuasive and powerful empirical evidence that there are a variety of ways to, quote, keep kids safe and also keep them engaged in their education.
Thank you, and I yield back.
Thank you very much, Mrs. Miller. You're very generous with time. But so now the gentleman from Illinois, Mr. Levin. Yes, sir, you have 5 minutes. Thank you.
Thank you so much, Mr. Chairman. Although I didn't move to Illinois, I'm still in Michigan. So I want to try to get to two things real quickly. I'm going to ask Dr. Jara in a minute about the workforce in our schools, but Dr. Jha, the whole problem from the beginning has been the politicization of this thing, which continues in this very hearing. Let me just ask you a few brief questions off the cuff, and then I want to get you as a doctor to just give a general statement about where we are. So the Delta variant has affected many more kids more severely. Is that correct?
Absolutely, Congressman, yes.
And even if we're vaccinated, we can be vectors. And
it's true. It's true, though far less likely for vaccinated, but yes, even vaccinated people can spread the virus.
And so schools are places, wonderful places where we all come together, adults and children, children who are old enough to be vaccinated, children who are too young to be vaccinated. We know, despite some of the things that have been said here, that even cloth masks are effective in preventing the spread. Is that true?
Yeah, so I agree with Mr. Zweig that there is a lot of variation. Cloth masks are not extremely effective. They probably reduce things by about 10, 20%. Higher quality masks like surgical masks make a big difference. You don't need to talk about N95s. Mr. Zweig kept saying it's either N95 or cloth mask. We know there's a lot of difference between the two. There's some really good middle ground of high quality masks that kids can wear. Masks that I'm seeing on my screen right now, that would be of much higher quality and kids are happy to wear it.
In the American Rescue Plan, we made the biggest investment in the history of our country in the public schools to help them provide whatever masks they might need, right?
Yeah, absolutely. And decent quality masks are relatively inexpensive and widely available. And what parents and teachers need is guidance on this, which the CDC has provided and which state health departments could also provide.
So if we all stuck together and looked out for each other, as the Torah, the number one thing in the Torah is that the Jewish holy book is that we have to look out for each other, not just for ourselves and for the stranger. How effectively could we take on this current public health thing with our reopened schools, happily reopened schools, if everybody who could got vaccinated and if everyone wore masks in schools? How well could we control this pandemic?
Yeah, Mr. Levin, much of this conversation has gone on about the harms of closing schools. I think many of us have been arguing for the whole year that it is incredibly harmful to close schools.
Absolutely.
But the good news is that's not the trade-off. That's a false dichotomy. We can keep schools open if we do vaccination, if we get kids masked up, and we do testing and ventilation. We can keep every American school open full-time this year.
Fantastic. All right, Dr. Jara, one of the middle schools in my district, East Point Middle School, had to close for a week because they didn't have enough educators and it wasn't an outbreak. One of our big newspapers reported that 22% of the district's teaching positions are vacant. And this is a problem that's existed before the pandemic. People are tearing down our teaching profession. They're tearing down teachers' organizations as if there's some evil thing when they're really just the organization of the teachers. Talk to us not just about your own district, but as a leader in education. Is there a longstanding crisis about school bus drivers? Every kind of position in schools, and what do we need to do about it?
Absolutely, Representative. Great question. And it is. I mean, I sit with the Council of Great City Schools as a member with urban school districts, but it's not just urban, it's suburban, it's rurals. We have a huge bus shortage. We have a substitute shortage. Our workforce is struggling. We need to, and I think this administration, we've done is we really prioritize education. So I appreciate Congress in K-12, but it is a huge hurdle for us to continue and keep staff engaged. When the national conversation across this country is about public schools. So really is an effort. This is a great conversation that we need to have. I got principals that are substituting classrooms, that are serving foods just to try to keep our kids engaged, our children in classrooms. Our bus shortage is something that we are struggling. We're trying to incentivize using the AARP money, but we have to have a nationwide long-term strategy around how do we keep our schools open. So we've done that in partnership with everybody in this community, and we're all committed to doing that here locally.
Thanks, Dr. Jara. Well, Mr. Chairman, I would just say that if we all lifted up education, treated teachers as professionals as they are in other countries like doctors, lawyers, accountants, and stopped attacking their organizations and really compensated them well and respected them and all the people who work in our schools,
Thank you.
we would be in a lot better position. Thanks, and I yield back.
Thank you, Mr. Levin. And my two youngest would really appreciate that since they are school teachers. Thank you. Let me see. The ranking member of the full committee, Mrs. Fox, you.
Yes, sir, I'm prepared.
Okay, so you have 5 minutes, Dr. Fox.
Thank you very much, Mr. Chairman. Mr. Zweig, we had two parents testify before this subcommittee earlier this year about the impact of school closures on their families. Each recommended that we do everything possible to keep schools open in the future. One even suggested we should think about schools like we do hospitals and grocery stores. Do you agree that outside of some obvious and compelling circumstances that we should resolve not to close schools for extended periods?
I certainly do agree with that. And what's interesting is, in doing research for my book, all of the academic literature prior to the pandemic also said that. None of this was planned to close schools for a year, regardless of the various dynamics of the pandemic and the sort of transmissibility and virulence of this virus. From looking at a variety of different sort of pandemic playbooks and academic papers written on this, none of them mentioned closing schools for a year as one of the measures.
Right. Well, I appreciate the fact that you talked about CDC, about the statistics on masks, and I believe your comments are more believable than comments of others who say, oh, masks absolutely work. Nothing that I have read has said that all masks absolutely work. So you talk in your statement about the need for clear metrics from the CDC for how and when COVID mitigation strategies are unwound. I wrote a letter back in July to Secretary Becerra asking for, among other things, the data used by the CDC to recommend universal masking in schools. Ironically, I sent that letter 2 months ago today, and I still haven't gotten a response. In the conversations you've had with experts in the
when they initially released guidance for summer camps, they wanted children to wear masks at all times in all circumstances, including outdoors. And I immediately reached out to a number of experts who I wanted to ask, does that make sense to you? Because from what we knew, the virus is very unlikely to be transmitted outside. And conversely, the harms of a child in 90-degree heat in the Northeast wearing a mask all day playing soccer, for example. After I wrote an article about this, the CDC almost immediately thereafter changed its guidance and rescinded that recommendation, even though none of the underlying data had changed. So that's one example where it's okay. This is what science is about, is questioning. And lo and behold, the CDC, as it rightfully should have, ultimately changed its guidance in that particular circumstance.
Yeah, we want questioning and we want modifications. You know, everywhere I go in my district, people say, where in the heck is the common sense in Washington, D.C.? There seems to be none up here. So one more question. You've already alluded to the fact that they changed the recommendations this summer when they about camping, but also CDC revised its school mask recommendations, quietly removed guidance for phasing out masking and other mitigation strategies in school. Why do you think it's so necessary to have clear off-ramps for the disruptions these strategies cause in learning?
It's a great question, and that's really become the term du jour, off-ramps, because it's not clear to anyone when these variety of interventions are going to be unwound from schools. And I speak to some of the top scientists who are in this field of implementation science. And one of the things they know is that once you implement something, it is very hard to reel it back. And one of the ways to unwind something is to have very clear metrics, made knowable to the people so they understand why they're doing it now and when specifically it can end, rather than sort of vague, elliptical or general statements about when sort of unknowable amounts of vaccinations or other things. So I would encourage the public health authorities to at least say, here's when we can stop X, Y, and Z. And that will enable local officials to then have the ability to do that.
Yeah, the goalposts keep changing because it appears that it's a control issue. Thank you very much. I yield back.
Thank you, Dr. Fox. Not to take away anything from David, if I have to listen to medical opinion from him or from CDC, I go to CDC all the time. Let me now recognize Ms. Manning. Ms. Manning, you have 5 minutes.
Thank you, Mr. Chair. Mr. Zweig, I have a variety of questions, so if you could give me a yes or no answer, I'd really appreciate it. Do you have a medical degree?
I do not.
Do you have an educational background in epidemiology?
I do not.
Do you have an educational background in infectious disease?
I do not.
Do you have an educational background in pediatric medicine?
I do not.
Do you have an educational background in public health?
I do not. I think you're aware of my resume.
No, I actually am not, but let me continue.
Oh, you're not? Okay,
Do you
go on.
have an educational background in healthcare?
I do not. I am a journalist. I think you're aware of what my
I'm aware of that. Thank you.
standing is.
Dr. Jha, I believe you do have a medical degree and a master's degree in public health, both from an esteemed university, and I believe you're recognized as an expert on pandemic preparedness and public health. Can you respond to Mr. Zweig's position that our schools should have reopened last year during the height of the pandemic and his assertion that children in school should not have to wear masks?
Yeah, Congresswoman, I'd be delighted to. I do have a medical degree and I've been studying public health for about 20 some odd years. So with all due respect to Mr. Zweig, I think there's a lot of things that he said that isn't consistent with the data. Let me be very clear on a few things. The first few months of the pandemic, school closings made a lot of sense. We didn't know where things were. By last summer, most of us in public health were calling for a strategy for getting schools back open again. And I've been on the record for more than a year now saying that we can open schools safely. And obviously, as we've gotten more and more tools and we've understood the virus better, it has gotten safer and safer to do so. On the issue of masking, to go back to something Representative Fox said, none of us believe that masks are perfect. Masks, and I laid out in my strategy that we need to do a variety of things, and the data on masking is reasonably good overall for everybody, including kids. What's really interesting is Mr. Zweig has multiple times referenced a CDC study, a large CDC study, and if you keep listening to him, he says, did not find a statistically significant difference. What it found was a 20% reduction in infections for places that had mask mandates, but it did not hit statistical significance. It found a 40% effect for masking mandates for adults that did hit statistical significance. You can take any study, and this is what people do who try to spread misinformation, is they will go through every study and find a little hole in every one. As a doctor, when I'm taking care of patients, I have to look at a broad range of evidence, including mechanisms of disease. This is an aerosol, airborne disease. We know masks are going to be helpful. And when you look at the totality of the evidence, not the CDC, not the American Academy of Pediatrics, no expert that I know of doesn't believe masking is helpful for kids. So with all due respect to Mr. Zweig, I don't know who he's been talking to, but the consensus in the entire medical community, from conservatives to liberals, if you understand how this disease works, masking is helpful. Not everything, not perfect, but it's an important part of how we keep kids safe.
Thank you, Dr. Jha. And by the way, do you have your children wear masks in school?
They have, ever since they've been able to go back to school. I think they started going back in March.
Thank you very much. Ms. Fort, as schools reopen, students most impacted by school closures, students of color, students with disabilities, underserved students, are returning to in-person learning, facing widening achievement gaps, systemic barriers to learning, and increased risk of exclusionary discipline and harassment, among other issues. And that is a big issue in my district that I represent. How should districts be working to create safe and inclusive learning environments as they reopen?
Thank you so much for that question. And my kids wear masks in school as well. All students deserve to learn in an environment where they feel they belong, where they have their identity affirmed, where they're engaged and have agency in their learning. But too often, we all know students face many barriers on the inside and outside of school that make it challenging to learn. We believe that to address these inequities and ensure all students have access to equitable learning environments, we have to protect as well as expand district funding for whole child supports. We also need to make sure that our teachers and professionals in the classroom have access to the supports that they need. And it's critically important that we invest in a coordinated district-wide effort, including working with community-based organizations to identify and proactively re-engage students who are offline, hard to find, or have left school altogether. And then my 1 minute left, we absolutely need to do something about the use of suspensions and expulsions for minor offenses. We cannot keep our kids feeling safe in school and have that agency and an affirmation of identity without it.
Thank you, Denise.
Thank you, and I yield back.
And thank you, Mrs. Manning, for the outstanding questions that you asked. Very much appreciated. And now the gentleman from New York has been so patient. And I recognize Mr. Baumann for his 5 minutes before I recognize our chairman, who could be the chair. Mr. Baumann, sir,
Yes, thank you, Mr. Chairman. Thank you to all the witnesses for joining us today. Some of you know, before coming to Congress, I worked in education for 20 years, had the privilege of being an elementary school teacher, a high school guidance counselor, and a middle school principal for 10.5 years. So I'm still very plugged into what's happening with our schools in New York City. As you know, the largest school district in the country, serving 1.1 million students. And I have a very stressed out, frustrated wife who's a second grade teacher who I love very dearly and try to support her as much as I can. Thankfully, the city did implement mask mandates and strongly encouraged vaccinations from the very beginning of the full reopening. And thankfully, we have positivity rates of about 0.27% across the city, which is excellent, even in a large school system where class size is way too big. Obviously, we want the race to be 0, but that's a really good number. However, I've heard from parents throughout my district and across the city who are still very concerned about the Delta variant, who live in low vaccination communities with higher COVID rates in terms of the community spread, who really wanted a remote option for the safety of it, but also because some students, might be surprised, actually did well with remote learning because of social anxieties related to school. So I wanted to ask Dr. Jha what you think about a remote learning option going forward. Personally, as a former educator, I thought remote learning was here to stay, just to help with lower class sizes and some of the other issues that happen, particularly in middle schools. As you know, middle school can be challenging. So I wanted to have Dr. Jha respond to the remote learning piece, and then I have a follow-up question if we could get to it.
Yeah, so Congressman, thank you. And New York City has just been doing an extraordinary job. Very, very complicated situation in New York. And, the schools some of them are very, very old. Again, I don't need to tell you, Congressman. I think they've done a great job because they've followed the science. And the science is they're getting people vaccinated. They're using testing. They're asking kids to mask up and adults, of course. It's working. On the issue of remote learning, it's interesting. So first of all, I think we all agree that schools should be open and in person full time. There are a small number of kids who do benefit from remote learning, and that should be a parent decision. And I think that's a place where either because they have specific health issues or they have other types of needs. I have generally believed that coming out of this pandemic, we've got to give people more choices. So a lot of talk happens about giving parents choices. I think on things that affect their kids and their kids only, it makes a lot of sense. When it comes to, not wearing a mask, well, it's not just about you, it's going to be everybody else. There, I think we've got to follow public health guidelines, but I'm pretty supportive of giving parents more choices on these issues.
Absolutely. Thank you for that response. We passed the American Rescue Plan several months ago, which brought unprecedented resources to school districts across the country. What I hope to see, and I believe the chairman and others had hoped to see, is the hiring of more teachers to help lower class size. In addition, outdoor learning spaces have been shown to also have benefit as well, and alternative learning spaces in the lower end of class size as well. And although that is not in school learning, it is still in person and helps with the overall development of our kids and the social emotional development of our kids as well. So I wanted to just throw that out there and ask anyone if they had a comment on the benefits of outdoor learning opportunities, particularly in parts of the country where the climate is warmer for longer periods of time and kids can benefit from it. Anyone could jump in.
Outdoor learning's fabulous. I pushed for it in my own village here at the beginning of the pandemic. Obviously, it makes everyone safer, and there's a lot of evidence that learning outside has other sort of holistic benefits. So yeah, it's a fabulous idea.
Representative Bowman, Superintendent Jara, for the record, I think one of the things that we've done pre-pandemic, and obviously you've seen expanding is outdoor gardens, actually some of the opportunities that we've had for children in the desert. So it's great that, we've taken advantage of that, but schools have been able to do that as individual schools.
Awesome. Thank you all so much. I yield back the rest of my time, Mr. Chairman.
Yeah, thank you, Mr. Bowman. May I inquire, Dr. Fox, do you have any more members present before I yield to the chairman, the full committee chair?
Not at this time, sir. Thank you.
Okay, thank you, Dr. Fox. Thank you. So now I'd like to recognize the OS present, very good leader in our committee, the full committee chairman, Mr. Bobby Scott, for 5 minutes, sir, please.
Thank you, Mr. Chairman. And I want to thank all of our witnesses for their testimony and ask first Ms. Ford if she could comment on the importance of student assessments to make sure that we get the data that we need to ascertain what inequities have been exacerbated by the pandemic.
Thank you, Chairman Scott. We need as much data as we could possibly get. And it's not just about the basic system of assessments or the assessment in the classroom that we have, but it's really a system of assessments that we need to go forward to be able to understand clearly what is happening in the classroom, how kids are being supported with the amount of online learning. And that type of rounded assessment is what will give us the most accurate and representative data. And in particular, when we're looking at inequities, which is what the Education Trust does every day, without that data, we are unable to really dig down and see what is going on in the schoolhouse experience for Black and Latino students. So now more than ever, in particular with the amount of investment that Congress has put towards school, nearly $200 billion, we need that data to be able to drive resources and drive outcomes.
Thank you. Mr. Jara, Superintendent Jara, you mentioned a lot of initiatives to bring students back up, to make up for the time they lost. Are you able to target those initiatives to where they're best needed based on the data that Ms. Ford just mentioned?
Representative Scott, great question. Yes, I mean, we've had not only the summative, but also the formative assessments, and we use our student level data from where kids just came in, and also from the spring from last year to really target some of the support. Yes, sir.
Good, thank you. And Dr. Jha, I think you've indicated that we all agree that students should be in school. There are a lot of things that they can't get not in school. Can you, we heard in the opening statements that the Republicans have criticized the American Rescue Plan for not requiring students to return to school, safe or not. You've indicated that a return could be made safe. Can you say a word about what's wrong with parents having the choice as to whether the students should be masked or not?
Yeah, absolutely, Congressman. Look, I'm a parent. I have kids in school, and I want to have a lot of freedoms about how I raise my kids. But there are certain freedoms I don't have. I don't get to send my kids to school if they haven't got the measles vaccine. I don't get to send my kids to school if they're not properly clothed. Again, if there were economic issues there, I might need some help. But there's certain set of requirements that I have as a parent because it is good for the public health of other children. Those public health rules that require kids to be vaccinated, for instance, against measles, protect my children in the school. So while we think individual parenting decisions are extremely important, we have always made decisions for public health that protect all the kids and teachers and staff in schools. Masking is very much that. It's not a personal choice. It's not just about you. It is about the toxic air or the infected air you're going to breathe if you are infected, and you're going to subject other people to infection. And this is why in public health, there is broad consensus. There really aren't very many experts out there who think that kids wearing masks is not a helpful thing. And that's why we all believe this. And this is not, as I said, not an individual choice, a public health decision.
Thank you. And can you say a word about the social emotional learning that takes place when you're actually in school?
Yeah, it's extraordinarily important. I saw in my own children that when they were remote for almost a year, I think it was incredibly harmful. But it's not about my anecdote. The data on this is very clear that for many, many kids, being remote was very difficult and harmful, to be very honest. And so the question isn't, nobody should frame the question as remote versus in person. We all got to get kids back in person. That's the right thing for kids, great for families. The question has always been, how do you do it safely? We have the evidence and science to do it safely. And I keep hearing people sort of set up a false dichotomy. All of us believe that in-person education is better for children. The key issue is how do we do it in a way that keeps kids and teachers and staff safe.
Thank you. Thank you, Mr. Chair. You're back.
Yeah, thank you, Chairman Scott. And also I want to thank all the members and witnesses for the questions. I'd be remiss if I don't finally dawn on me, Ms. Fort. Now I remember you in our committee, and welcome back. So I now remind my colleagues that pursuant to committee practice, materials for submission for the hearing record must be submitted to the committee clerk within 14 days following the day of this hearing. So it's by close of business on October 13, 2021, and preferably in Microsoft Word format. The material submitted must address the subject matter of the hearing, and only a member of the subcommittee or an invited guest, a witness, may submit materials for inclusion in the hearing record. Documents are limited to 50 pages each. Documents longer than 50 pages will be incorporated into the record via an internet link that you must provide to the committee clerk within the required time frame. But please recognize that in the future, that link may no longer work. Pursuant to House rules and regulations, items for the record should be submitted to the clerk electronically by mailing submissions to edanlabor.hearings@mail.house.gov. That's edanlabor.hearings@mail.house.gov. Now, witness questions for the record. Again, I want to thank the witnesses for their participation today. Members of the subcommittee may have some additional questions for you, and we ask the witnesses to please respond to those questions in writing. The hearing record will be held open for 14 days in order to receive those responses. I remind my colleagues that pursuant to committee practice, witness questions for the hearing record must be submitted to the majority committee staff or committee clerk within 7 days. The questions submitted must address the subject area of the hearing. I now recognize the distinguished ranking member for a closing statement. Dr. Fox or Mr. Owens? I don't see either member. Oh, here's Dr. Owens. Mr. Owens. Burgess, please.
Okay. Thank you, Mr. Chairman, once again for calling this hearing. I want to thank our witness for offering their expertise today. Mr. Chairman, I'm actually encouraged by the level of agreement in this hearing. We've had several hearings in the spring during which some of my colleagues on the other side of the aisle questioned the need to reopen schools and were dismissive of the experiences of parents and children during the remote learning. I'm happy to see us move beyond that and have a universal acknowledgement that kids need to be in school. That being said, we seem to disagree on a couple of key points. First, Republicans recognize that our conversations around COVID mitigation needs to be more comprehensive. The benefits of each proposed COVID mitigation strategy needs to be evaluated on its own merits for actually slowing the spread of the virus and using a cost-benefit analysis that weighs the potential benefit of that strategy against the harm that strategy might cause to long-term health and development of our children. For example, thousands of students are right at this moment being unnecessarily quarantined and separated from school. So schools might be open officially, but they're closed to many students who desperately need to be in class. Very few are acknowledging the ongoing harm being done to vulnerable students by these policies. Second, Republicans seem more comfortable with the ambiguity of the data than my Democratic friends. It has been stated uncritically several times today that mask mandates in schools definitely work, despite the fact that CDC's own study looking specifically at the student mandates found no statistic significance benefits to the student mask mandate. Let me just repeat that. The CDC's own study looking specifically at the student mask mandate found no significant benefit to the student mask mandate. As a result, Republicans believe states and school districts should have the freedom to adopt the policies they believe are most appropriate to their state. In contrast, the Biden administration has invented a novel legal interpretation related to mask wearing and is applying it to a politically selective way to investigate only a handful of states that the administration does not like. Finally, Mr. Chairman, Mrs. Clark has made this point repeatedly. Republicans believe that CDC owes Americans much more transparency than they provided today. What is the science the CDC is using for its recommendations, and why do these recommendations differ so significantly from the recommendations of our peer countries? And what are the metrics we should be using to determine when COVID mitigation strategies should be unwound? The CDC has not shared. Finally, I want to address another issue, one other issue. One of the Democratic witnesses suggested that Mrs. Wise is peddling misinformation. To be clear, if that is true, so is the World Health Organization and many other health authorizations around the world. Those are the facts. If you learn nothing else about this pandemic, surely you must have learned that the scarcity of good faith and informed debate doesn't accomplish anything, and in fact does tremendous harm. Mr. Chairman, again, we owe our children better than that, and I yield back.
Yeah, thank you very much, Mr. Owens. Before I go on to my own closing statements, I don't recall anyone questioning that, suggesting that Mr. Zeig, David was giving misinformation. The line of questioning was on the particular achievements that is received for his specialty or whatever. But I think we all respect the witness testimonies and responses equally. So let me. I want to thank all our expert witnesses for their testimony and for all that you have done to support our schools and children's education. Today's hearing has made it clear schools can only reopen and stay open safely if they implement science-based strategies to mitigate the spread of COVID. This is especially true as we experience a resurgence of this pandemic. Students and educators have not been shielded from the Delta variant's devastating and horrific impact. However, schools who are enforcing masking policies and taking precautions are experiencing far fewer and far less severe COVID-19 outbreaks. Thanks to the American Rescue Plan, schools have the funding and guidance they need to prevent and navigate outbreaks. As our witnesses shared, many schools are using the funds they receive from the American Rescue Plan to purchase PPE, update ventilation systems, and make up for lost time in the classroom through evidence-based interventions like intensive tutoring and after-school and summer learning programs. Unfortunately, too many Republican-led states and school districts are ignoring the science, leaving students and staff at risk. As I shared at the beginning of the hearing, this is the third year students are going to school under the cloud of a pandemic. If we want our students to succeed in a healthy environment, we must put their well-being and education first. We must put students first. I look forward to continuing to work with my colleagues to help schools reopen, stay open, and build a more equitable education system for our students. Seeing that there's no further business without objection, the subcommittee now stands adjourned. Thank you, everyone, and have a wonderful day.